Hi, I'm Jorge Barrera. I'm a reporter with CBC's Indigenous Unit. And on this National Indigenous Peoples Day, we're here in the beautiful Wabano Centre in Ottawa, which sits on unceded Algonquin territory, to have a town hall with Indigenous Services Minister Jane Philpott. Minister, thank you so much for being here.
Thanks so much for inviting me.
And so for this event, we are going to take questions from you out there in Facebook land and also here from our town hall audience. But I'm actually going to grab the first question, if that's okay with everybody. Now, something came up today in Quebec, and Inuit leaders are calling for the resignation of the health minister there, Minister Barrett, for suggesting that under the influence parents won't be allowed on flights accompanying their children from northern, mostly Indigenous communities, traveling south for health care. And as you know, Quebec has had a long-standing policy of not allowing relatives or parents to accompany children who need to go down south for health care. But they're modifying that policy. But now this minister is under fire for using this stereotype. Minister, I'm just wondering, do you think that this minister should resign for that?
Well, what I can say is that this is it's a disturbing situation, and I think, as you have highlighted, the comments that were made today, which were so hurtful, were made in the context of a circumstance that's already been troubled in terms of supporting parents being able to accompany their children on medical evacuations. And so in that context, more than ever, it's really important that public officials speak very respectfully, that there should be no sense of barriers to access for these children to be able to get the care they need, to be supported by their parents. And I understand that Minister Barrett has made some comments in response very recently in terms of an apology, but this will have done damage to what was already a troubled relationship.
Okay, thank you, Minister. Now we're going to actually go to our town hall audience for the first question. And Christine, if you can stand up and introduce yourself to the minister and then give her your question.
Thank you very much for this opportunity to ask a question. My name is Christine Weckerly, and I'm an adolescent health researcher with McMaster University. And the question I'm asking really relates to the interconnectedness of sustainable development goals. Has research been conducted on the connection between environmental insecurity, such as access to clean drinking water, and youth mental health and resilience in youth? Thank you.
Thank you, Christine, for the question. It's a really important one, and certainly as an academic, you'll know that these are the kinds of things where research is done all the time, but there is no question that a whole range of issues contribute to people's sense of wellness, both physical and mental wellness. And things like access to clean drinking water, decent housing, being able to live in a safe and secure environment, those all contribute to mental wellness. So in fact, I think there's a large body of evidence that points to that, and that's why when we are addressing the tremendous needs in the area of mental wellness across the country in general, but in particular for First Nations, Inuit, and Métis in this country, that we will not solve the challenges that are there without also addressing what we call the social determinants of health, the ability to be able to have those basic necessities of life, as well as education and economic opportunities.
Okay, and we're going to take another question from the audience. And Marion, you have a question. Introduce yourself as well and ask your question.
Good afternoon, and thank you for taking my question as well. My name is Marion Williams, and I work on behalf of the Pediatric Chairs of Canada and the Canadian Association of Pediatric Health Centres. I would like to ask, how can we build research capacity to advance the health status of Indigenous children and youth?
Thank you for your question, Marianne, and for being here and your interest in this issue. There is a tremendous amount that needs to be done in the area of research capacity building. Actually, when I was Minister of Health, my previous portfolio, one of the groups that came and met with me were the leaders of the Aboriginal Health Research Network. And they pointed out to me very early on that the proportion of health research in this country, when you looked at how many studies were done by, for, with, or about Indigenous peoples' health, it was only 1.5% of all health research in this country, and we know that Indigenous peoples comprise close to 5% of the population. So that was a good documentation of the under representation of research. I'm happy to say that the Canadian Institutes of Health Research has made a commitment to address that, has made more investments in that area, and a commitment to try to reach, I'm not sure what the target goal is, I believe it's around 5% of their research. But one of the challenges, as you know, is that the research can't be done to Indigenous peoples, and the capacity building is incredibly important. I'm happy to say that the scientific director of the Indigenous health piece of the Canadian Institutes of Health Research is a fantastic woman by the name of Dr. Carrie Bourassa, who has a real passion for growing respect for Indigenous knowledge as equivalent with science. And she is one of the many people who's helping to build capacity. And so places like CIHR and many universities across the country, I think, are taking this very seriously, as well as the fact that organizations like the Assembly of First Nations, Métis National Council, and the Inuit Spirit Kanatami have also got a very strong focus on research. I know that you have more questions to ask, so I won't keep going on that, but there was an announcement just very recently, this spring I think it was, where the Inuit Spirit Kanatami announced a research strategy. So I think there's a lot of movement in that area, but clearly much more to be done.
I want to follow up on that thread in terms of the need for data and research and statistics, and going back just recently, the Auditor General of Canada have seriously criticized the department for their lack of being able to close that gap, the health gap, the education gap, the poverty gap, and he called it an incomprehensible failure. And in particular, he highlighted the fact that the department has failed to adequately actually get statistical data on education, on health. 3 years now into the mandate, this issue is not the first time it's been raised. How can you possibly fix such a dire problem without being able to quantify it? Why is this still happening?
So your question brings up a whole range of issues, so I just want to touch on a couple of them. I actually, when I met with the Auditor General about that report, I thanked him for it, because I think any time that we're getting Canadians talking about the socioeconomic gaps that exist between Indigenous peoples and non-Indigenous Canadians, it's an important conversation, and his report helps to highlight those gaps that exist, which helps, I think, get all Canadians on board with addressing the issues. He called it an incomprehensible failure, and I took disagreement with that, because I said to him, this is not incomprehensible. We know why those gaps exist. In fact, the Truth and Reconciliation Commission said it as it relates to health outcomes. The TRC call to action number 18 says, we call on all governments, federal, provincial, Indigenous governments, to acknowledge the fact that health outcome gaps exist because of the discriminatory policies of past governments, and I would argue that many of those policies are still in place. And so we know why the gaps are there, and the TRC specifically spoke to policies like residential schools, which was one of the most egregious policies. So that's all to sort of say, first of all, it's not incomprehensible. But I would say that the Auditor General did highlight the fact that we haven't done as good a job as we could on data in the past. He had a difference of opinion in terms of how data could be collected, but what I have pointed out in this conversation is that the federal government should not be dictating to First Nations, Inuit, or Métis what kind of things are measured. We have in the past, we have actually put an enormous reporting burden upon communities to be able to send us all sorts of pieces of information, which has been criticized. And in fact, we're changing that. So we, in Budget 2016, put $2.6 billion into primary and secondary education. And we are now working with our partners, First Nations, Inuit, and Métis partners, to talk about what are the better ways of measuring outcomes, what actually matters. And in fact, one of your questioners spoke about the United Nations Sustainable Development Goals, and the Assemblies of First Nations, for example, has been suggesting that we should use UN Sustainable Development Goals as potentially more appropriate measures of outcomes of educational achievement than the ones that we've been using till now, and we're actually working in that direction.
Okay. And one of the things that stemmed from this, and I'm going to go to a Facebook question about this because the question is about something that's connected to these socioeconomic gaps that create, there's a lot of tendrils that flow from them. And I have a question here from Facebook. Thank you, Amy Miranda. She asks, how can you sleep at night with all of the Indigenous children in crisis in this country? Which is the child welfare question, which you have said is connected to suicides and also stemming from poverty.
Well, it's a profound question. I think it should be hard for all of us to sleep at night when we realize the state in which many children live in this country. And I, in my portfolio, as I've traveled to many communities across this country, I'm frankly appalled by some of the living conditions that I've seen. We have a tremendous amount of work to do to bring justice and equity to the day-to-day realities for Indigenous peoples. You spoke about one particular issue around child welfare, and it's actually an issue that's very relevant today. We're talking about kids being separated from parents. As we know, there's obviously a very disturbing issue taking place south of the border, but in the same way here in Canada, I suspect this audience knows, and maybe those who are watching on Facebook know, that every single day in this country of Canada, there are children, babies, being taken away from their moms and dads, Indigenous children in... 400,
you said 400 a year in Manitoba.
In Manitoba alone, 400 a year has been documented by the Assembly of Manitoba Chiefs. And the circumstances under which this happens are even more disturbing, where a mother will have a birth alert on her chart. She may not even have been told that she was marked from the time she enters that hospital. For reasons that are no fault of her own, the fact that she had grown up in care herself, for example, or that she's living in poverty, and that her baby is taken from her. So this is completely unacceptable, and we're working with our partners to completely transform the approach to child welfare.
But I think this is the issue, is that as you've termed this is a humanitarian crisis. You've said that. Usually approaches to crisis is immediate action, but what we've seen is more incremental and striking up, councils to review stuff and getting ministerial representatives to go. It's a crisis. Children are being taken away, and they have been for generations. Residential schools, 60 schools, and now this. If it's a crisis, why is there an incremental approach to a crisis?
Well, I would challenge your characterization of the approach as incremental. I mean, I would like to say right now, and I shout it in any audience that I can, stop. Mm-hmm. Stop taking babies away from their parents without letting them know their right, the parents' rights, the children's rights, making sure that every possible alternative solution has been looked into. Thankfully, I can say that we have actually taken very firm measures. We did just recently, for example, in our most recent budget, put $1.4 billion into child welfare. And what we said specifically was that the way that money flows has to change. Right now, or up until now, money has flowed according to how many kids get apprehended. So as agencies apprehend more children, more money flows to the non-Indigenous foster families. And we have said that's no more. We will support preventive costs, what agencies and organizations do to prevent the apprehension of children. Sadly, it doesn't change the system overnight. We're working with partners on actually changing laws and putting in place for the first time a federal law that will set those national standards, that will make it very clear that Indigenous peoples have the right to care for their children, to raise them according to their culture, surrounded by their family and in their community. I wish I could change it overnight. I can't do anything single-handedly. Everything needs to be done in partnership, and we are working as fast as we possibly can. Okay.
I'm going to go back to a Facebook question, and I have a question. Thank you, Gabe Natalie Took. Gabe asks, Inuit are studied to death. We needed action 20 years ago. We need action now. We need real dollars for healthcare, mental health, childcare, education, good water. When will the federal governments cough up real money to tackle these life and death issues? So
I'm really hearing the pain in that question, and again, we are facing generations of discrimination and denial of rights of Indigenous peoples, and I understand people's impatience to want to change everything immediately. The severe intergenerational trauma that's been inflicted upon Indigenous peoples will not simply change overnight. But the kind of investments that we've made and the relationship that that we're working on restoring and reconciling with Indigenous peoples, I believe will go a long way. In the last 3 federal budgets, we've had $17 billion worth of investments. Much of it goes to the things that this person has asked about in terms of investments in tuberculosis for specifically around Inuit Nunangat. Investments in areas like supporting the National Inuit Suicide Prevention Strategy, which we funded right off the start. But it also, I think we need to acknowledge that part of it is addressing the real deep roots of the circumstances, and that's this denial of rights. And you know that one of the things that the Prime Minister has been really clear about is that we need to make sure that the rights that are already, it's not as if people need to go looking for their rights. Indigenous peoples have inherent rights, they have treaty rights. Those need to be recognized across the country and affirmed so that in fact people will not have to go to court to prove that they've got a right to land and title, that they've got a right to raise their children, that they should have their health care and educational needs addressed. So we are working, Minister Bennett and I, side by side, where she is really working on that deep relational piece, and we are continuing to work on all of those priority areas in my department, like child welfare, health, education, infrastructure, and economic issues.
Now, staying with the North, I started my journalism career in Northwest Territories. I worked for a newspaper up there. And one story that still sticks with me was the death of a woman from Fort McPherson named Effie Blake, and she died from tuberculosis. And that was in 2001, and we're in 2018, and we're still talking about tuberculosis. And back then, politicians were, up in arms saying, how can this happen? How can this happen? Like, you were health minister before you took on this role. Why is tuberculosis not being eradicated in a G7 country?
It's a fantastic question, totally legitimate question, and I ask the same thing: why has no government been able to address this so far? In part, many governments have never talked about it before, so I don't think there's ever been a government that did what we did this year, where I stood side by side with Natan Obed, the president of the Inuit Tapiriit Kanatami, on World Tuberculosis Day, and said, we are going to eliminate tuberculosis in Inuit Nunangat. We're going to reach the World Health Organization target of 2030 and hopefully do it much before that. And we're going to put the money towards it to make that happen. Not only the money for things like the drugs and the x-ray machines and the equipment and the nurses, but also address the housing shortage. So $400 million to address the gaps in Inuit housing. So I think that it takes tremendous political will to do this, but it also takes investment and it takes a plan. So we now have a tuberculosis elimination task force. And what's probably most important of all is that this is being led very much by Inuit leadership working in partnership with the federal and provincial and territorial governments.
Okay. We're going to go to a question here at our town hall, and Natasha Hiltz-Commanda. Natasha, you have a question. Why don't you introduce yourself again? And
my name is Natasha Hiltz-Commanda. I'm from Kitigan Zibi. I'm Algonquin and Ojibwe, and I grew up here in Ottawa. The Friendship Centers are Canada's most significant urban Indigenous service delivery infrastructure. However, since 2014, there's been no youth core stream to support urban Indigenous youth. As 61.1% of the Indigenous population live in cities, the TRC Call to Action 66 calls for multi-year youth funding. Will the Indigenous Services Department of Canada be looking to fund urban Indigenous youth at the core level again?
Thank you for a great question. Really raising a really important issue, and in fact I would be very happy to follow up with you and get some of my team to connect with you, because this is exactly one of the things that we're looking at right now. You've highlighted the amazing work of Friendship Centers, which do extraordinary work across the country and have been underfunded for a very long time. We did put additional funding into Friendship Centers recently, but I think there's much more to be done from the urban perspective. This is a place where governments need to really work well together, because it's not just the federal government that should be interested in this, but of course provincial and municipal governments also have a role to play in terms of effective youth strategy for Indigenous youth in cities. So as I say, there has been funding already that has flowed to Friendship Centers. We're looking at additional ways through some of our infrastructure funding to be able to support even some of the facilities that are in desperate need of repair and renovation in some of the Friendship Centers across the country. But this is something that we are actively working on, and I hope that I'll have some good news to say in the months to come on that.
Is one of the issues with the urban strategy is the delivery? Who do you deliver services through? There's issues with the Congress of Aboriginal Peoples. I'm just wondering if that's an issue. Like, do you not know where? I think
what you're saying is that there are jurisdictional issues when it comes to municipalities. The federal government has very clear obligations, for example, on things like education and healthcare for First Nations on reserve. That falls very clearly into federal responsibilities. When it comes to people living off reserve or non-status, the rules aren't quite so clear, and people fall through the gaps as a result of it, and we've admitted that. So I think we need to do a much better job finding ways that we can build partnerships with Indigenous organizations, but as well with all orders of government, to be able to address not just things like Friendship Centers, but housing issues, for example. I've seen some fantastic work being done in some parts of the country around addressing housing that's specifically designed to be respectful and appropriate for Indigenous peoples in big cities, but there are many cities where there's huge gaps, and obviously under housing and homelessness is a big issue.
Okay, well, we're going to go to another question from the floor. Jean, you have a question that you want to ask the minister. Introduce yourself and ask your question.
Madam Minister, I would like to know, what is the time frame for correcting drinking water problems for Indigenous communities?
Thank you very much for that question. It's actually a question that I think Canadians are really interested in. I'm surprised it took this long for it to come up, because whenever I'm at town halls, it's almost always one of the first things that people ask about, because Canadians, I think, were shocked to realize that so many communities, First Nations communities, don't have access to clean drinking water. So this was something that the Prime Minister took a particular interest interest in, and when we announced our budget in 2016, he stood up and said that we were making investments of what's now about $2 billion, and that we would make sure that all long-term drinking water advisories for public systems on reserve would be lifted by March of 2021. He gave a 5-year time frame. Now, as soon as I say that, I know there's going to be a whole bunch of people on Facebook that are going to say, why can't you get it done right now?
Yeah,
That's
why?
what people say to me all the time. I'm used to hearing it. And of course we would like to get it done right now, but nobody's been able to do it by snapping their fingers, nor have they ever been able to do it in the past by giving only 1 or 2 years funding at a time. We're the first government that's actually said, this needs long-term funding. So we've got the funding framework in place for the next 5 years, as well as ongoing funding, but it also requires a really detailed plan. When our government took office, there was no roadmap for which communities had long-term drinking water advisories, how were they going to be designed, who would get it done, what were the unique circumstances, the geographic circumstances of each community. So it takes that kind of detailed plan, and sometimes, you know, there are short construction seasons, there are only certain times of year that you can get equipment into communities. I'm happy to say that so far we have, during the last couple of years, been able to lift 64 long-term drinking water advisories, which is really good news for those communities. I got to go to, oh my gosh, somebody help me out, Slate Falls. Slate Falls in Northern Ontario about a month or so ago, and we got to see their beautiful new water system. That community had had drinking water advisories in place for 14 years, and the kids that were running around in the school that I visited had never been able to turn on the tap in their school and drink that water safely. So when you see that happen, it's an amazing feat, and you also see that those communities are fully engaged. They've trained local young people to be the water operators in their community. So we are absolutely determined to meet the Prime Minister's target on that. I have told my entire department that failure is not an option on this. We will deliver on it. But it, again, is something that takes more time than one realizes, but with a strong plan and the firm determination, we will make sure that we get that done.
So 74, right? Still on long-term?
74 to go.
Okay.
Yeah.
But long-term boil water advisories aren't the only issue. Some communities are on intermittent boil water.
Yeah.
And they're not necessarily caught by this.
They aren't all caught, although what we are now also doing is tracking another group that we're calling at risk. Okay. So the communities where we're seeing that the system is fragile, may be in need of repair, and might slip into a long-term drinking water advisory, and that had never been done before as well. So we have another separate plan for the water systems at risk. Okay,
I'm gonna loop back to an issue that's connected to both the urban issue and also child welfare, and it's a question from Facebook. Thank you, Tanya. She asks, given the number of kids in care, what about services for children aging out? There's a definite lack of services and support for those who age out. I'm just wondering what have you been doing, if anything at all, or your department or regional office has been doing about this issue?
Thank you to Tanya for the question. I think what that highlights is that when you're looking at the issue of children in care, I see it as sort of 3 particular things that you need to focus on. One is preventing children getting apprehended in the first place. That's the ideal, if you can get the supports to families so that those children aren't apprehended, or they can go to a family member in their community. The second is the family reunification piece. So those some tens of thousands of Indigenous children who are currently separated from their families, how can they be reunified? And there's some fantastic work being done by First Nations family advocate offices across the country, et cetera, that are doing that good work of reunification. And then this other really critical issue is children aging out of care. It is an area where there's still a lot of work that needs to be done. We are seeing some good programs that are addressing that. We're looking at the possibility I mentioned earlier around legislation. One thing I've learned is that in other countries, I believe it's New Zealand, that has actually extended the age in which children can be cared for in the child welfare system to 21 or 25. I don't know that that's entirely the answer, but at least it gives that option. We're also seeing several provinces. British Columbia would be one that I would point to that is particularly looking at children who've grown up in the foster care system, has now offered free post-secondary tuition to children who've grown up in foster care in British Columbia, which I think is an incredibly positive initiative. And they're doing it in a way that's actually wrapping supports around those kids as well, because the housing and other needs of those young people is really critical. So it's definitely an area where there's more work to be done.
And the provinces are are they a stumbling block, some of them? I know when you had that meeting with them, you guys couldn't even come up with a joint statement that everybody agreed to. Which provinces are, because like this is a crisis, right? There's children who are dying by suicide. There's, families that are suffering a lot every single day. Which provinces? What's the hang up here?
So I think you can't necessarily put any of them all in the same basket. Every single province has a slightly different circumstance, and some have done much better than others on this issue. Even territories like Yukon, for example, has actually made progress because they changed their policy to say that that if an aunt or a grandmother, for example, wanted to care for the child, in many jurisdictions, if it's a family member, they can't be supported the way that a non-Indigenous family would be to take care for the child. And there's been policy change in Yukon that has addressed that, and they've had fantastic results as a result of that. I think one of what I have hoped to do by trying to draw attention to this issue is to wake up all of the partners who need to be involved to say this is wrong. Every provincial child and family services minister should be obsessed with this, to find, particularly the ones where there's such severe overrepresentation of Indigenous children. And they also, I think, we need to continue to have this conversation around respecting the rights of Indigenous peoples, so that where communities say, we got this, we don't need the province stepping in, and there are communities like that, like Shuswap First Nation, for example, that has said, we've put a bylaw in place, we're going to take care of our own kids. And I hear the same thing from Oneida Nation on the Thames, has said, you know what, we have 400 kids in care, we want to run our own system. And we hope that one of the things that we could do through a legislative option is to make it very clear, the rights are already there, but what legislation can sometimes do is make it abundantly clear to everyone that Indigenous peoples have the right to this particular jurisdiction of child welfare.
Well, the talk of legislation, I mean, we're waiting for legislation on your department split as well. Anyways, well, we're going to go to Facebook. Okay. Lisa Solis asks, thank you, Lisa, for this question. Why have you cut back in health services and coverage of medications and treatments? I guess this is the FNIB side that you took on from Health Canada when you.
We might want to ask Lisa if she could be a little bit more specific on that.
Well, I guess one of the issues is the BC First Nations Health Authority. There are some things that they won't cover that are covered in other provinces. So there seems to be not an uneven coverage. of certain.
So I'll encourage Lisa to write to me.
Okay.
Jane.Philpott@canada.ca. That'll go to my department, not to my personal inbox, but that way we can at least hear from her. The circumstances in British Columbia, if that's what she's talking about, are distinct from the rest of the country. We've actually seen amazing progress in terms of closing health outcomes gaps in British Columbia because of the fact that there is a British Columbia First Nations Health Authority, which is an agreement that was a tripartite agreement between the province, the federal government, and support it, but it's entirely run by BC First Nations Health Council. They are now actually involved in the health benefits portion of it as well. And so that may be the issue here, but in the rest of the country, the non-insured health benefits that are associated with our department, I'm not aware of any cutbacks, and would be very happy to hear if there's any. If I'm wrong, I will certainly look into that. But it's certainly an area where, if anything, we have actually enhanced it. There was money in our most recent budget in that area, and we have. You know, last year's budget had over $800 million in budget 2017, $1.5 billion new money in healthcare in budget 2018. So really, we're increasing budgets on things like home and community care, where they had been completely flatlined for close to 2 decades. There had not been an increase in home and community care, and we corrected that last year.
Will cannabis be covered? Medical?
So the non-insured health benefits make their decisions on coverage based on an organization called the Canadian Agency for Drugs and Technologies in Health, and if they make a recommendation for coverage, then those drugs are covered.
Okay. I have another question from Facebook, and it comes from Ian Fraser, and he asks, where are the new housing and fresh water supply to reserves that you promised?
So the water thing, I think we've covered already, and I'm happy to talk a little bit more about that if you want to, but maybe I'll go to the housing piece since we haven't talked about
there's still
housing.
A huge gap.
So I would say, along with issues like the overrepresentation of Indigenous children in care, things that keep me awake, on the list of things that keep me awake at night, that's one of them. But the other thing that really keeps me awake at night is housing. This is probably one of the biggest challenges that we face as a country, is in terms of the gap in housing for First Nations, Inuit, and Métis. Estimates vary, and we're actually working on getting better data on what the numbers are, but we're probably short at least 80,000 units if you look at First Nations on reserve in terms of the gap for housing. So that's not to speak of the urban needs, that's not to speak of the needs for Inuit, for example. 80,000 units. I'm happy to say that with the money from the last 3 budgets, we've cut into that. So we have now 13,000 homes that are either brand new or being renovated. So that's not bad, but we actually realized that we need to do things differently. And I actually met with the Chiefs Committee on Housing and Infrastructure just this week to say that the status quo is not going to work. We've got, an additional $200 million a year that was announced in our most recent budget to continue to try to address the housing gap. But actually, we need to look at doing business differently. We need to look at what are the policy gaps that are preventing people from being able to get access to financing if people want financing for building houses. I think that we need to actually have a whole new approach in terms of what kinds of homes are being built and who's building them. So, right now we're flying up to remote communities, synthetic materials from the south, to build homes that don't always last very long, and they're not always particularly beautiful, and they're often being built by people from the outside, using materials from the outside. And then you're in these fabulous communities that are surrounded by beautiful natural resources, huge trees and beautiful rocks. And I'm thinking, why aren't we asking, what did people live in 2 generations ago, 3 generations ago? And in fact, there are people that are doing that, and I've seen some of the amazing projects, like Skeetchison First Nation in BC has got a roundhouses project. They've actually gone back to their traditional style, using local logs to build these absolutely gorgeous roundhouses, and now hoping to work with other First Nations and develop an economy around home building. So I think we as a federal government need to support and encourage that kind of creativity that gives people the dignity that comes with living in a beautiful home. And we have done a tremendous disservice by denying people the dignity of a beautiful home, not to mention accepting the fact that people live in these terribly overcrowded situations.
Okay. Well, we have a few minutes left, and we have an extra question from the audience. Carl, you have a question?
Hi there. My name is Carl Scheboyer, and the reaction that I got when I said that I was coming to this event was mostly laugh reacts on Facebook, but there was only one question that anybody wanted me to ask should I have the opportunity, and that is, When will you give us our land back?
Well, thank you for the question. Thank you for bravely coming here, despite what people said about whether you should or shouldn't come. There is no question that there is a lot of work to be done in terms of reconciliation around land and supporting a way that that communities don't have to go to court to prove their rights and title to their land, and to speed that process up, where we've in the past seen communities take, you know, decades of time and millions of dollars to be able to prove that the land is theirs. So some of that will come through the work that Minister Bennett's doing on the recognition of rights. Within my department, one of the things that we're doing is addressing something called additions to reserve, which you may be familiar with, where there's actually has been until recently a massive backlog of land where it's already been made clear that First Nations have title to land, but we haven't in the past gone through a process to be able to make that clear and add that land to reserve. We are doing a lot of work right now to speed that process up so that it can that it will be done much more quickly. So I don't know that there's necessarily a specific timeline, but I can tell you that we are very much pressed with the need to do this much better and much faster, and to find a way that we are going to be able to do justice and live up to our obligations.
Now we have 5 minutes left in this. I'm going to take another question from the audience. We only have 5 minutes left, and they're going to cut off the feed. So, oh, we're going to get you a microphone. Hold on.
Wachi kagashe hawten dagus in the Hason. Masquan dotem. And a no you sconina, dobis get to Hikomagashe, CBC News, Jocelyn Wabanoia, Telnish and Dishnahatagon. As a bundle holder, we understand our sacredhood, nationhood bundle as being that we are of our own nation. We are of our own land, our own language, our own laws, our own spirituality, our own governance, our own resources. And as a mother of a special needs son, you've met Wabano before, who had brain surgery. He was in the institutions of the colonial child welfare. And while he was in child welfare, if you can look at that second floor there, he fell from the second floor of the foster home and fractured his skull and had bleeding of the brain. He is now permanently brain injured. We are still looking for resources under the Jordan's Principle. I am here demanding for our monies from our First Nations trust accounts. My son needs to be seen by a specialist team in Sacramento, California for chronic traumatic encephalopathy. My son is already making the decision for brain donation to Boston to help other people who are suffering from brain trauma and chronic traumatic encephalopathy. How many 19-year-olds do you know that are thinking about their demise when they leave this earth? Now I have another relative, Camara Wabano, who needs to go for brain surgery in Toronto. You've spoken lots about monies that are available that we cannot access. It's not your money, it is our money. We need to be able to get to the doctors and the specialist teams. Now, my Jaban was the treaty signatory for treaty number 9. Medical chest clause. We need full access without being penalized in any way, shape, or form. We need to do it now. I need to ensure that my son's quality of life is respected holistically. Miigwech.
Prime Minister, can I answer this question?
You called me Prime Minister. I'm Minister.
No, I said Minister.
That's right.
Oh, maybe.
No, I thought. First of all, miigwech, and I'm very concerned to hear about the troubles that your son has had. It's nice to see him again. And you're absolutely right that no child should be going without the care that they need. And in fact, that's what Jordan's Principle is all about. And that's why we have set aside money to make sure that no First Nations child will be denied access to the care that they need for their health. So I will make sure that one of my staff gets in touch with you, speaks to you today, and I would like to hear more about your particular circumstances. Before our government took office, no child was getting access to care on the basis of Jordan's Principle. We now have a 24/7 call line for access to Jordan's Principle. We've now approved over 80,000 requests for access to care. So I'm not sure of the particular circumstances that you've raised with me today, but I will assure you that we will follow up, and I will certainly make sure that we see what can be done to be able to make sure that your son has the care he needs. Let's follow up directly on that. Okay.
We're gonna sneak in one more question. Thank you, Jocelyn, for your question. We're gonna sneak in one more question from Facebook. Nathan Sunday asked, why was the National Inquiry into Missing and Murdered Indigenous Women and Girls given only a 6-month extension when they wanted 2 years?
Thank you for the question. This is an important one. We all know how urgent it is that this inquiry is done, that it's done well, that we get good answers and good recommendations, and that in fact the terrible realities of what has taken place for missing and murdered Indigenous women and girls needs to stop. And in fact, the work that I'm doing on child welfare, for example, is part of how we are already taking many of the steps that we know the inquiry will be talking about. Minister Bennett has been the lead on this portfolio, so she's the best person for your questioner to ask for specifics. What I can say is that we wanted to make sure that they got extra time. They had asked for extra time to be able to do further inquiries, and so that has been granted, and it will allow them as well then to be able to, once the meetings are finished, to be able to have time to write the report and get that report in, get those recommendations out there, and give us the opportunity to act on it as quickly as we can. Well, that's all the time we have. Thank you, Minister, for coming to this town hall and taking the questions. Thank you to the Wabano Center for hosting this event in your beautiful room here. To our town hall audience for your questions, and thank you to the people out in Facebook and Twitter land for not only watching but also contributing to this discussion. So thank you so much, and happy National Indigenous Peoples Day. Happy National Indigenous Peoples Day.